For each panelist, I want to answer the following question. 75 years old, you've been getting PSA up till age 75, and it's been normal. At 75, would you continue getting PSA? Starting with you.
I would say that I would not offer the patient a PSA testing at that stage. But I would certainly have a conversation with them as they, if the patient asks me why, and explain to them why, and let them make their decision. But my recommendation would be not to.
Dr. Brooks.
Yeah, if the PSA has, particularly if you've got a history of normal PSAs over an extended period of time, I would not. Even if, one of the things to keep in mind is that there are two large trials, both of them done in Europe, that did show that screening for prostate cancer may lower a man's risk of dying from prostate cancer. But in both of those trials, you didn't see any difference in the likelihood of men dying until at least 7 or 8 years after the screening started. So in other words, doing screening for a 75-year-old man, you're not likely to benefit him at all until he's close to 85. So you have to start looking at the likelihood of how long men are going to live. You can't just look solely at age, because every 75-year-old is not the same. You have to look at his overall health condition as well. But the chances that you've had normal testing up to age 75 and then suddenly you're going to have abnormal testing combined with the now lower likelihood of surviving for another 8 or 10 years, for me, I would not offer him screening.
Yeah, the follow-up to Dr. Brooks, there's 75-year-olds who act like they're 45 and physically are in a 45-year-old shape. Then there's 45-year-olds who act like they're 75. So I think the answer is it's not just the number, it's how healthy the patient is. So I'd have that discussion. If I have a 75-year-old who's not taken one pill for anything else, they could live to age 90, I'll have that discussion. Say, you know what, if we find prostate cancer in you, let's talk about after the test comes back. If you have prostate cancer, are you interested in getting a treatment? Now, at age 75, I don't think there's many surgeons who are going to take your prostate out because it just not worth the risk of surgery. But that patient could have radiation or implant of radioactive seeds or just following it. So again, I'm going to continue to be a politician here and not answer the question directly. It depends. It depends on how healthy that patient is. For me, I'm going to have it done. My dad had it, so I'm going to go from 1 in 6 chance to 1 in 4 chance of having prostate cancer sometime in my lifetime. And knock on wood or plastic, I hope that I'm healthy enough at 75 where it'll make a difference for me to know.
So you would have it.
I would have it.
Dr. Brooks, I didn't get. Did you? I'm asking you. Would you have it?
Would I personally?
Yes. No. And would you?
Not if I've had normals up until 75.
Okay. And Dr. Kittles?
Is he black?
I'd ask you to look in the mirror.
75. oh, would I? Oh,
You.
would I personally? I mean, I'd be happy. No. Okay, so I don't know. That's a good question. That's a really good question. I mean, at 75, I think I'd still be 25. So that's a good question. But when you look at the amount of time that person, the life expectancy, it may not at that stage be that beneficial. So
I'm asking you.
Would I?
You, Rick Kittles, Dr. Rick Kittles. At 75, all your PSAs have been normal up until then.
I would have it because I just want to know everything anyway. Now I would make a decision based on whatever, but I would have the PSA. Yes, I would.